Morning, everybody. I'm Chris Krasnowski with the Wisconsin Institute for Healthy Aging, and also a member of our Wisconsin Falls Free Coalition. Welcoming you here today for the Strategies to Build and Sustain Community Falls Prevention Coalitions in Wisconsin webinar. Really pleased to have a great cast of speakers here who are going to talk about their experiences around falls prevention coalition work, successful strategies for creating and sustaining their local coalitions. So we're really looking forward to hearing their wisdom and you're giving you the opportunity to ask questions and learn a little bit more about some tools that we have available to help support local falls coalitions around the state. I want to thank our sponsors today, UW Health, Inclusa, Eye Care, and Humana, who are all supporting this effort in terms of the webinars that we produced around falls prevention. We do really appreciate their commitment to reducing falls in the state, and this is another more evidence of their interest and efforts around this area. And with that, I will turn it over to Susie Ryer. Susie.
Thank you, Chris. I appreciate that. So again, my name is Susie Ryer. I am the co-chair of the Milwaukee County Falls Prevention Coalition. I also work with Advocate Aurora Health, and I also represent the Falls Free Wisconsin's State Steering Committee, along with many people who are on the call. So we're really happy to have you with us for our panel today. And I'll introduce our speakers here before we turn things over. So our goal is to really build off the great webinar that Chris and the team put together back in September. So as we energize efforts around innovations that we can do around fall prevention, now we wanted to talk about how do we bring people together and what are some of the strategies we can utilize to build coalitions. And I think what we've learned is that there's not just one way to do that. And there's a lot of different examples from across the state that we can utilize. So today I have joining me Barb Michaels with Brown County Fall Prevention Partnership, Dave Taylor from the Fall Prevention Alliance of Northeastern Wisconsin, and they will talk about how they kind of approach the start to their coalition. And then Kathy Hagranis, and I hope I said your name right, Kathy, with Finding Balance Together, who will talk about how they their approach to getting their coalition started. And then myself and my colleague Ann Gallo will talk about the work we did in Milwaukee County. We'll go from kind of presentation to presentation and then have a chance to do all of our questions together at the end of the 3 different panel discussions. And then from there, we will transition and talk a little bit about the fall prevention quick guide that our state group has put together to really support the rest of you on your journey towards building and re-energizing falls coalitions across the state. So with that, I'm going to go ahead and turn it over to Barb and Dave.
Thanks, Susie, and good morning, everybody. Happy to share here and start out first with just some of the key progress points from our Brown County Fall Prevention Partnership, and then I'll turn it over to Dave, and he'll share some of the real successes of about a nonprofit that he started. So if you go to the next slide, Susie. So just how this all started back in 2013, almost 10 years, coming up on almost 10 years. ADRC and some of our health systems here and a few others came together to say, how could we share talent and resources and work together on the Stepping On program to really help sustain that, improve availability of it, and actually accessibility of it for the community. So that went probably about 2 to 3 meetings. And at the end of that meeting discussion, we came out with a really good, solid plan. All of us felt putting that together. And as we were about to abandon that, the group said, hey, can we stay together and can we tackle something else that's a common issue? So with that, in 2014, formally what started was the Brown County Prevention Coalition Steering Committee. We started to look at other initiatives that were common to all of us we could tackle. It ranged from care transitions, diabetes, a couple other topics. And at the end of the day, we came back to falls. Those drivers then, and still now, that really drove that piece were the high percentage of trauma cases with falls, the number that we see on a daily basis here in Brown County, and then really the escalation in our adult population that we would see in the years to come. If you go to the next slide. So next key transition point was 2016, along with our RTAC, Green Bay Metro Fire Department. We started a pilot to pilot an EMS referral system for falls. That lasted about 3 months, and then from there, that was adopted into practice. Another key point is then the steering committee had continued for a few years and then decided to launch a subcommittee that would actually start the implementation and continue the implementation of different initiatives. That today is called what you see here, the Brown County Falls Prevention Partnership. And next slide. Another key juncture point was we started placing things on a website, both for community members and professionals, and ADRC is housing that, at least for the short term. And that's our website that you can see. The structure is we have a chair that has rotated. Currently it's Shauna, who's at our Green Bay Metro Fire Department. 6 meetings annually. And then as far as the makeup of that group, it's a variety of community and healthcare professionals, but also includes our level 2 trauma centers. And then a variety of task forces will spin off from time to time based on the needs and the objectives that we're trying to meet. Next slide shows some of the, not all of them, but just a variety of the task forces we've had to prepare videos, plan different community events. We continue to do process improvements with our online EMS referral system. We put together different communications and distributed to all of Brown County churches related to falls prevention. And then most recently engaged some med students in our project. And then this year as well is launching a marketing task force that would be made up of marketing experts from the member organizations. And one of the first things we're piloting there is more targeted messaging through the MyChart patient portal. And next slide. Just a few learnings. I can't share all of them, but a couple that we wanted to highlight was really the integration and constant participation back and forth with our local RTAC, which is Region 3 here. Through the years, we've really always come back to re-looking at our goals. Were they specific enough, measurable enough? And times we've done well with that, and times we've had to improve it. So that's something we like to keep in the forefront. We don't have a lot of expectations of members, but just started placing in attendance expectations, and we'll probably grow with that as well. Passion around the table can get the best of us sometimes, where we've had 8 and 10 objectives and then realize we can't, there's not always enough resources to keep after all of those. So we have been more conscious about reducing down to 3 or 4 key objectives so that we can experience wins. Another learning is discussing early in the process, how are we going to fund an initiative? And that leads to one of the last pearls here. Back in 2018, when Dave had the idea, starting a nonprofit that could become a funding arm for this whole effort. So I'll turn it over to Dave to explain more about what he has started and advanced in that nonprofit.
Hi, everyone. Can you guys hear me okay? Everyone good? So anyway, my name is Dave Taylor. So first off, I'd like to say happy Veterans Day to any veterans out there. I spent some time in the military prior to going to EMS and fire. So thank you to any veterans that are on the phone, families of members. I think it's great what we do. And so we'll kind of go with that. So anyway, my name is Dave. I work at Aurora Baycare Medical Center in interventional cardiology full-time for a living now. I spent about 20 years flying for the Eagle 3 medical helicopter up here in Green Bay. In 2009, I actually became the RTAC coordinator for Region 3. So I spent 10 years working with DHS along with flying and doing EMS and fire. And so that's where Barb and I got connected, is being connected to your healthcare coalitions and your RTACs and working with DHS. Of course, you see the data that comes out of DHS or from the CDC, and you see falls are huge. And I thought, this is terrible. We got to do something about it. So when Barb and I got connected, early on, I said, what are we going to do with this? And my big initiative for this was really, how do we connect public safety with public health? And we have to do it fast. We can't do it this paper version. We can't do it with fax. HIPAA privacy is a big thing. You know, how are we going to do it? So that's where the JotForm thing came into play. JotForm is a huge company. They're based out of California. And we were one of their first customers that came on. And it's really sort of it's an app-based program that's secure. It's HIPAA compliant. It's actually quite expensive now, but I was one of their first grandfathered programs to come in and just sort of start playing around with things. And so we have been grandfathered to pay almost nothing. They give us probably about $100,000 worth of product every year of having apps and having people connected to this. And so I have it really kind of all over the region, and I'm only using about 50% of it. So I can actually add on those of you who are in the community and say, hey, we're going to be a small program. I'd like to do this. I could probably add you onto my program for nothing and help you run it sort of from the backside. And it really is just that. It's connecting A to B, and really is fallers from the 911 system, falling at home, pickups, tip ups, whatever it is you want to call it, and then be able to get it to your ADRC, your health departments, whoever it is that you want to connect to. We also have the fire departments on there for some hoarding issues that we can connect fire chiefs to, and we have some things with health and human services as well, if you want to have a direct service to that. So anyway, we started working with DHS, and there's really not a lot of money available to us in this sort of realm in the coalition. And so I said, I'm not a lawyer. I don't have any background in this. I said, I'm going to start a nonprofit. And I don't know if you guys have ever done this, but it takes a lot of passion to start a nonprofit and to run a nonprofit. There's a lot of money out there. It takes about under $2,000 to start a nonprofit and actually make it a large nonprofit. You can start one by filling out an application. You have to stay below $50,000. The IRS it has it so that it's a pretty mainstream thing. And so as a coalition, you're thinking, we want to raise money as a nonprofit, but I don't want to have staff. All of our staff are volunteer. I'm volunteer. I volunteered thousands of hours into this. You can do it fairly cheap, or you can do it the big way and apply for something greater than 50,000. But now that's a 60-page application. It takes a year to get. You have to follow some rules, but it's simple to do. If you go to the next slide, I'll just run you through some just where we're at with things. So I have two initiatives. One is fall prevention. I do it because I care about the community. I think it's a huge thing. We're all getting older. Our parents are there. They're falling, everyone's falling. How are we going to go with this? So I just hold it near and dear to my heart, just because I think it's have to do as a person. This is me donating my passion back to the community. The other one is the active shooter piece. You'll start to see for this. I picked this up from the police, fire, and EMS background. We do a lot of education for police, fire, and EMS. I've purchased a lot of equipment through police, fire, and EMS. And so you'll see an equipment trailer that comes through here that has a lot of equipment on it. So I have two main projects. They are completely separate from each other, very doable in a nonprofit world. If you want to kind of go down this realm, if you say, well, we don't fit the Green Bay concept. Everyone's different. Everyone's going to have their own thing. Next slide, please. So this is my board of directors. I have a bad gamut of the group that I started with. I met through the RTACs years ago, and these are close friends that are brilliant people that you can't do this alone. You can't do this as just the ADRC. You have to have a coalition and have passionate people, and whatever they bring to the table is what they bring. And if you get enough people, you'll have a successful program. Next slide, please. This is just my overall thing. So for the last 3 years, I put a lot of this stuff in just equipment alone. So you see the 200,000, but I'm a small nonprofit, basically a guy driving this by myself. You can raise money. You can raise money, put it back in the community. You don't have to do this full time to get money out there. There's so many foundations out there. Brown County alone has 632 nonprofits. in one county. So we're all going up the same dollars, but it's doable. This is a really doable thing to be able to put back into the community. And I'll go through some of the projects that we've done just as a nonprofit side. Next slide, please. These will be really quick. So the falls are serious, 1 in 5. This is CDC data that you guys know this. I don't have to tell you this. Next slide this is actually one that I really like. So of the jot form referrals that we've had in Brown County, or I should say Northeast Wisconsin, we've had 449 jot form referrals completed in multiple different counties at multiple different levels. So if you just did generic math on it by seeing that, we pulled off of the John Hopkins website, you know, an average fall is about $35,000. I don't believe that's right. I work in interventional cardiology. I know what we charge for a heart cath. I know what we charge for pacemakers. It's a lot of money. But anyway, if you did the math on that, that's $15 million we potentially saved the healthcare system or in the community. That's a generic number, but it gives you some hope to say, you know, even if it's just one. Barb and I have had a lot of phone calls, banging our heads against the wall saying, what are we doing? Why do we have these meetings? This is nuts. And we always fall back on the same answer is, if you save one, if we just save one person from a hip injury, if you save one person from a fall and saved a life, or just save families from heartache, maybe that's enough. It's 449 a great number? Well, when we have thousands of falls, 32 a day, but it's still, it's 400 and, well, it's more than 450 now. So start small, do what you can. There's no magic key. There's no golden ticket to this. You just have to keep banging away at it. And maybe we'll get somewhere as a group. Maybe we'll get somewhere as a state. Maybe we'll get somewhere as a coalition. So next slide, please. This is just real quick slides. This is just the rescue task force thing. So you see, where's all the money going from a nonprofit? We just have an equipment trailer that we use. So if you hear something about this from your coalitions, like it came from me, I have 2 projects. You can go to the next slide. That's just what's in the equipment trailer itself. We just do a lot of training on the nonprofit side as well. Next slide, please. This is just the last slide, and I'll just finish up real quickly. So anyway, I'll take on any questions later on, but really, if you're looking to do a nonprofit for your coalition, it's doable. This is a doable thing for you to raise money. We're a nonprofit that is project driven, so I don't have a budget of just $100,000 just sitting there. Barb and I come up with a project like the WIA grant. You put some time and energy into writing a project. You gain money for that. You pay what you need to pay, and you move to the next project. And that's where I think the having the fiscal agent side of a nonprofit really is beneficial. I think that's the reason why the government allows us to keep doing that. So it's working well for us. I'd love to be able to have it explode, but again, it's not my full-time job. I just do it because I want to. So that's all I have. Anything, Barb, you want to add? Correct?
No, I think Susie, you're planning to take questions at the end, right?
Yeah, I think we'll do it at the next section. Thanks so much, both Barb and Dave, for not only your passion and the work you guys have done, but for being with us today. And again, I just think the model that you guys have done has been so innovative and really exciting to learn about. So with that, I'm going to turn it over to Kathy, who's now going to shift and talk about a different approach and kind of what they did with her coalition with Finding Balance Together. So take it away, Kathy.
Always have to unmute, always have to remember that. So thank you for allowing me to join you today. And again, to follow Barb and Dave, who have pioneered this so much in Northeast Wisconsin, and we are in the Fox Valley. So thank you for letting us join you. So I'm Kathy Hegrenes, and I not only represent Finding Balance Together, but in my day-to-day life, I'm the Injury Prevention and Outreach Coordinator at the Level 2 Trauma Center in Neenah, Wisconsin, Theta Care. I'm also on the Executive Council of our RTAC, which Dave mentioned earlier. Next slide, please. So I want to tell you a little bit about how we got started. The trauma medical director at our Level 2 Trauma Center really embraced falls as a passion. He talked to everyone he could think of. He gave presentations to Kiwanis, Lions Club, anyone. And one of the people that he knew and connected with was a community leader who said, why is more not being done? Why have I not heard about this if it's that big of traumatic mechanism of injury? So she is instrumental, Kathy Seifert is instrumental in us moving forward. But in the meantime, there were these other efforts that were occurring in the background. The Winnebago County Falls Coalition was an active coalition that got together, did networking, did education, met monthly or every other month, depending on the year. And then there was also another group in Outagamie County through the ADRC, and they focused their efforts on an annual event. And we knew of efforts that were occurring in other places. The Fox Valley Regional Trauma Advisory Council was doing little efforts to prevent traumatic injuries, but in 8 different counties. And we just started thinking, how can we work smarter and eliminate duplication? So the result is Finding Balance Together, which is a coalition of regional organizations who have a common goal of reducing falls. We came up with our mission and vision, which has changed over the years, but we've decided on a lofty goal recently of a vision to create a fall-free community. So Susie, next slide, please. So this is our current leadership team. They're committed. We meet, and what I want you to see is at the bottom, we meet with a strategic planning and resource coaching nonprofit service. And they are working to help us continue our forward motion, because as has been mentioned before, you know, projects seem to move people forward, but sometimes in between those projects, there can be a bit of a lag. Next slide, please. So over the years, we have had many organizations who have been a part of Finding Balance Together. It waxes and wanes depending on the commitment levels, depending on if people stay in their positions or they move to a different area. So just again, a small representative sampling of who we've had over the years. Next slide, please. So what I want you to know is this took time, and our community leader helped us in starting in 2016 to come up with the concept and how to bring people together. And from there, we really addressed what were our next steps. And we wanted to bring together, as I mentioned, those similarly minded organizations. We wanted to help them adopt similar repeated messaging so that no matter whether you were in Outagamie or Winnebago, you would see that same messaging, it would resonate. And if you were a younger member of the family who lived in Outagamie and your family member lived in Winnebago or Calumet or one of the surrounding counties, you would still hear that similar message. So you could discuss it, again, working upstream. So in this particular situation, we had a large meeting with, sorry, lost my train of thought. That happens as you age. We had a large meeting with community leaders, and our community leader was instrumental in bringing some of those mover and shakers to the table. We ran our concept by them. We had their input. We also brought in, of course, fire chiefs, head of ambulance services, people who would actively be involved in fall prevention, pickup calls, and so on. So this particular coalition progression is just to show you that from the time we started with our website and doing some of our initial marketing materials until we had our first event, we had all sorts of little projects coming up with marketing items and things to give away. Next slide, please. So we wanted to work together and come up with things that would make us memorable. So other than our events, we had all sorts of handouts. We have our website, we had notepads, we had business cards. And actually, here was an interesting thing. I don't know if you can see in my little picture, but that business card is a very small, a small item, but it's larger than a regular business card. And we put information on the back so that we could write tips to a community member, or we could write to another organization. Hey, join our meeting. Here's our next meeting time and date, and we could leave it with them. We also did a whiteboard video. That is our Meet Millie video. Next slide, please. We also partnered heavily with our Regional Trauma Advisory Council, who helped us get out our placemats. Our placemats went to meal sites. They also went to coffee shops. They went to anywhere where we might find older adults. And with all of these, we had that check your risk for falling. We also had something fun to do, because often when you're waiting for your meal or your order, you might do a word search, something like that. We also did articles in local healthy living magazines and things like that. But another thing I want to point out in the lower left-hand corner is our night light that our RTAC has helped us secure for our events. That's a night light where the light points down. And so when someone gets up at night, it doesn't shine into their eyes. So next slide, please. So this is just something we were really thrilled about. So in our last group meeting, we were able to look at our data. And from the time that Finding Balance started having our community events and really got our information out into the community, we were able to see a decrease. Now, we can't say for sure, obviously, that it's directly related, and yet it still gives us life. It gives us, we're excited. The blue line that you see is Wisconsin as a whole, and the red line is our RTAC region, which is an 8-county region. Next slide, please. So in 2020, we know the pandemic hit. We pivoted from, as many of us did, from in-person meetings to virtual meetings. And these Zoom meetings we promoted through our Facebook. We actually paid for Facebook ads to try and encourage people to attend who might not have heard of us before. And we relied not only on our experts within our coalition, but also who we knew outside of the coalition. Next slide, please. And this particular year, we are working on a fall kit grant project. It was a small grant, and we are able to put together 200 fall prevention kits. Our grant guidelines are that we have to do this within the Oshkosh area. We have great hopes to expand this, but again, it's creating awareness. It's getting people to do risk assessments. We also are really thrilled that we were able to offer, as you can see on the fall kit items, the $5 discount coupons to get them into the evidence-based classes. We're really excited about that. If we can get them to reach out to their ADRC, not only will they find that evidence-based class, but they'll find so many other resources there. And again, you see all of these organizations coming together, including Rebuilding Together. If you don't have a connection to Rebuilding Together, please look and see if you have one in your particular area. They work with older adults and people in need, and depending on their qualifications, they may be able to help them with grab bars or things that will help them stay in their homes. Next slide, please. So we're not afraid to ask. Every time we go out, we say, hey, we want to put your logo on our items. We want to put your logo in our presentation. And that is something that our community leader really did. She connected us with foundations, as Dave mentioned earlier. She connected us with other movers and shakers. Next slide, please. So this is an exhaustive list, and I will not go through it, but just so you can see some of the efforts that were contributed to our success. And we're really thrilled that we have been able to maintain, again, even throughout that pandemic challenge and so on. So next slide, please. So on this particular slide, one of the interesting things is bringing in the in-kind partners. We were able to reach out, for example, to the public library. And our in-kind partners are kind of a stepping stone to creating that awareness. So at the library, we were able to put up banners during Fall Prevention Month. With some of our space donations, we met at Festival Foods. Most of the Festival Foods have a community meeting space. So Festival Foods knew about us already. And then when we asked them for something, they were familiar with us. We also Community First Credit Union, who was one of our early sponsors for our community events. We use them for our meeting space. And again, it's creating that familiarity and not necessarily having the ask right up front, but these were our in-kind partners that we had. We also, in our leadership team, everybody devotes their staff time to moving this forward. Next slide, please. So sustainability, this is really the big piece. The Winnebago County Health Department, who had the Falls Coalition, they are our fiscal agent. They hold any monies that we are able to raise that do not have to go to a nonprofit. And that is something, as Dave mentioned, that can be a challenge. If you are not a nonprofit, there are foundations or organizations that will not donate to you. So we found that to be a challenge, and we quite frankly have lost out on some significant potential grants that we were given, and then they said, we can't give it to you. But check with your county health department. It could be in their mission. If you're not the health department, it could be in their mission, and they may agree to be your fiscal agent and hold that funding for you and carry it over from year to year. Another thing is our Fox Valley Regional Trauma Advisory Council. So if you don't attend those meetings, please find them and become a part of it. That's a way to get connected with all of the EMS, the hospitals, anyone who is a part of the system of preventing traumatic injuries. And with our RTAC, we have injury prevention support, and we're actually a line item in the annual budget. So we know we have that money to work on fall prevention from year to year. It's not a lot of money, but it's there, and that's really good that we can count on that. Another thing is our Fox Valley Healthcare Emergency Readiness Coalition recently received their 501c3, oops, the 3 is missing, nonprofit, and they have included our Regional Trauma Advisory Council as a line item. So legally, we now have a way to access a nonprofit without going through all of those hoops that Dave did, because he told you it can be challenging. It can be done, but it's challenging. So this is our way that we are able to sustain ourselves financially, create our marketing items, and safely have a place to put the money that we are able to get to do our projects. So we are a project-driven organization. We have discovered that. We meet, but we really, as Barb and Dave mentioned, when we have a project, that's when everybody gets excited and are moving forward. So I'd like to leave you with some of the things that were our greatest successes, some of our challenges, and we think that some of our greatest successes have been our marketing materials and our availability of them, our ability to fundraise, to print those. And we've not only printed things outside, but we've relied on, say, a healthcare organization who might have an in-house printing service, and they donate that in kind. So our marketing materials were one of our really great successes, and we've made them so that all of our marketing materials are regional. Right now, we are about a 3-county area that we are blanketing, but our RTAC is 8 counties. And that's our lofty goal down the road, is to spread this throughout those 8 counties. So again, no matter where you go, it says that. And on the back of all of our materials, we reference the ADRC for that particular region with the 800 numbers to get people to reach out to those who can help them in their area. So our other successes are events, whether they be in person or virtual. We were really fortunate to have great successes with our in-person and growing every year, but we were really thrilled if we even, if we only got 30 people, it's that one person, if we could make that difference in one person's life. So specific projects are our success. Finding a community leader who will champion you. Our community leader connected us initially with a strategic planning coach, And then another community leader at a foundation connected us with our current strategic planning coaches. So in launching your coalition, it wasn't as important what we knew, because what we knew put together our marketing materials, but who we knew. Again, we weren't afraid to ask for money or find someone who really enjoyed asking for money. We talked to foundations, our RTAC, independent medical practices, your neurosurgery practice, people who deal with falls, but you might not think of them as a first line of donating money, rehab or physical therapy groups, the credit union who has a responsibility to make your coalition, because caregivers are dealing with people who might be likely to fall and they are exhausted. They might be likely to fall also. Pharmacies, YMCA, libraries, our challenges, specialty needs, website maintenance, updating. The fact that our fiscal agent was a government agency prior to that 501c3 through our HERC, and the RTAC is supportive, but the funds are limited. The fact that we now have that ability to go through a 501c3 is wonderful. We have that ability to spread our marketing materials and reach out to foundations and funders in multiple counties. And again, to go back, we really are proud of our marketing materials and really trying to get that message out. So again, thank you. We really enjoy working together with all of you.
I can't get off mute. Thank you, Kathy. We appreciate all that you guys are doing. And I think just a tremendous example of, this very community approach that you guys have taken and the journey you've been on. And I love hearing about the evolution, and none of us can do this the same over many years. So thanks for sharing everything that you guys have been doing. All right, so with that, we're going to shift gears, and then myself and my colleague Ann Gallo are going to talk a little bit about the work that we've done in Milwaukee County. And we're the babies on the block compared to Barb and Dave and Kathy. We're probably the newest of the three that are presenting today, and so we thank them for all their leadership and paving the way on the work they've done. So I'll start off. So just to frame a little bit of kind of where we're working in Milwaukee County. So obviously we have a large population here in Milwaukee County. And even though only 14% of those are adults over the age of 65, we know that we have a huge population that's very impacted by falls. And that in our community, obviously we have a lot of diversity as well as a lot of disparities. And so when we first started this work, we knew that we were tackling something fairly large, trying to cover this from a county approach. Where we started, just to frame a little bit into our health system, which is really where kind of the kickoff for this coalition started from. Ann and myself both work for Advocate Aurora Health. We're the 12th largest, and I think since I put the slide together, we're probably even larger now, nonprofit in the United States. And we serve a lot of older adults in our emergency departments, with falls being the #1 reason they come to us. So really at the start of this journey was, framing into the work that we were doing was that in our emergency departments, in our healthcare systems, we were caring for a tremendous number of patients presenting for falls, and all that goes along with that in terms of cost, healthcare utilization, and of course, adverse outcomes for patients and families. So why did we even decide that we wanted to go on this journey to start a coalition with everything else that we're facing? So certainly those high rates of falls and falls with injuries in our county was a huge portion of that, as well as, the stress it was placing on our healthcare systems. The aging populations that we saw. And the biggest thing that we were really hearing as we were starting to do more work in our emergency departments and with our EMS partners was this heavy burden on both of those systems, as well as the lack of coordination of care. In fact, our medical director was in a meeting and someone brought out a box of Dots candy, which we always like to put on our slides, and they spread it out on the table and said, you want to solve the problem, connect these dots. That's what we need to do. And so that was really the impetus for how do we better bring everybody together, connect the dots, and as a healthcare system, try to move outside of our comfort zone into this concept of upstream care and better working with our partners.
Thanks, Susie. Like Susie mentioned, our work in the emergency department to better screen older adults to improve our care identified that complex issue of, the high ED utilization of falls and falls with injuries. This prompted a meeting with key stakeholders that included, the Department on Aging, EMS, health systems, and really to kind of take a look and vet that idea of a falls prevention coalition. Obviously, everyone agreed, and that moved the work forward. So we completed a needs assessment by holding focus groups, a lot of different sessions, both with professionals, that included EMS, health systems, Department on Aging, health departments, and those in various settings in the community, such as case management, home repair, transportation, and then also a key partner really is to look at key community members themselves to really get a true understanding of the community's need around fall prevention. Sorry, my screen is, there we go. This identified the need to obviously work upstream and develop different ways to close the gaps between the levels of care. We were really finding kind of that there wasn't that bridge to be able to connect those. So we identified key themes, and that was, if you look here around this wheel here, it's the stigma, the lack of the communication and collaboration around it, the lack of awareness, the lack of knowledge and access actually to resources, both not just by community members, but also the providers themselves. And really looking at the community public health strategy for fall prevention by bringing together the health systems, government agencies, departments, and then community partners. And then we really took a close look at and leveraging the CDC study toolkit to really be able to encourage fall screening and prevention at the community level. The coalition structure, it was really essential from the beginning that we form a strong steering committee. And we honestly have had a very strong committee since the beginning. We've had 13 members pretty much since the start. And that was with diverse representation, which allowed different perspectives for us to be able to build the efforts. We have an equally strong coalition at large. So we have 40 plus members that consistently have been with us since the start and through the pandemic. Honestly, we really pretty much our whole coalition has been kind of through the pandemic. And so we moved to virtually, and that participation didn't drop at that point. Our funding initially was and still is currently a philanthropic grant through Advocate Aurora Health. And this was to support the time for Susie and I to co-lead the effort, understand the needs in the community, and really to be able to develop and launch the coalition. We have health promotion budget from the Division on Aging, also to create materials within the county to support fall prevention. And then also with the Southeastern Regional Trauma Advisory Council to be able to develop and distribute additional materials at the regional level. Our structure too, just looking at the coalition at large, it's essential again to have diverse representation. So I'm not going to go through the whole list here that you can see that, but we have health systems, Division on Aging, EMS, fire departments, but then also focus on disciplines to really take a look at some of the fall risk, pharmacy, physical therapy, occupational therapy, pharmacy, and then looking at the community as a whole. I will say, again, it's essential to have those community members present and really probably should put them first at the list because we really need their perspective to really be able to look at what the problems are. And then really utilizing this coalition and the structure to be able to gain the perspectives, to leverage resources, work collaboratively at best practice in fall prevention.
So we wanted to talk a little bit about kind of why we took the approach we did as we started this coalition off. And, obviously we've heard from other colleagues, different ways that the coalitions got started. And so, starting as kind of one health system, I think was something unique. Part of the reason we did that was, we identified early in our conversations was that there were resources that we had within the health system, whether it was the evidence-based literature, whether it was access to some of the key stakeholders that we really needed at the table, whether it was being able to kind of capture some of the large hospital data, That was part of where we kind of triggered the idea that, we could really be the leaders. The other thing that we found, kind of skipping to the third bullet point, is that oftentimes talking to our community partners, they found it really hard sometimes to approach the health system to engage them in work like this, finding the right person, finding those who could commit time. And so by us kind of coming out to the community and being the initial kind of band leader of this, really helped us to put that healthcare system face forward, and to commit that time and resources that needed to be there. We also found that we were able to then access and leverage a lot of programs and professionals that were already doing some of this work, and to be able to better connect these individuals to some of the things that were happening. We've really committed to not just being a one healthcare system approach, and early on, as Ann mentioned, we were able to engage our colleagues at Medical College, at Freighter, to make sure that we really had all the health systems in the area present, along with all those great community partners. So we took the approach early on of trying to put our focus a little bit more on strategy and creating kind of a strategic plan to where we wanted to focus our efforts. We knew that, actions and events were certainly going to be a component of that, but we wanted to start with this. What is it that we really want to accomplish? What are these 5 key themes that we had identified from the community, and how do we really strategize to address these themes that we're hearing from our stakeholders? So we set strategies to connect with each of those 5 themes that Ann touched on earlier. So first, we knew that in order to address stigma, we really needed to have a broad communication strategy that allowed us to hit awareness from various different levels, from the older adult level, from the family and caregiver level, from the healthcare provider level, from the community member, community partner level. So wanting to be able to reach people in a lot of different ways. We knew that we wanted to be able to better track our data, something I'll talk about probably in our challenges a little bit, but really to be able to establish a dashboard that allowed us to better capture this data and monitor our impact as we move through. We knew that we, just by forming the coalition, part of what we wanted to do was create these relationships. Milwaukee County is very large, but a lot of our partners cross through various entities of the county. No one stays just in their suburb or just their pocket. And so we wanted to really make sure people knew each other and knew how to connect with each other. We also knew that our fall prevention programs, which are fantastic, and our evidence-based programs are wonderful, but we knew that people are not accessing those or having connection to those in the ways they could. So really trying to leverage that and promote that in the work that we were doing. And then finally, that education piece, trying to put the tools and resources in the hands of those who needed those tools to be able to better perform not only screenings, but interventions as it relates to falls. So some of the things we focused on in our communication strategy, we have partnered with our colleagues at Milwaukee County Aging Services through their social media platform to be able to post monthly tips of the month. We've recently partnered with our colleagues at Marquette University in the Department of Physical Therapy to have students help us create some of the messaging and imaging around this to be able to leverage that a little bit more. We have a biannual newsletter that we put out through our community partners as a way to put things in print and reach older adults kind of where they access the community. And then just recently, we were able to create a video library of our community impact stories. One of the things we really centered in our work early was the need to hear from our community members and to feature them in our monthly coalition meetings. And so several of our speakers, we were able to also video record and have those stories to ground us in the work we do, and to be able to share the various perspectives of older adults who've either been impacted by a fall or by fall prevention efforts. For our education, we put together toolkits really trying to leverage the CDC study resources, as well as connections to our local resources. So we've been distributing those through not only our events, but through kind of a broad grassroots community distribution campaign, asking people to take these and utilize them in a variety of ways. We've had some of our non-medical home care services who've used these as part of their admission or initial contact points. Several of our paramedic units and our mobile integrated health units have started to utilize these in their post-fall responses. And then just recently, we were able to get the toolkits created in Spanish so that we can also make sure that we're reaching a more diverse population. This past year, we were able to do education to our emergency management, our EMS providers through our Office of Emergency Management, and we're able to do a webinar series for them as it relates to fall prevention and things that they could do. And then we're also working now to really get back to the primary care providers and physicians through a couple different presentation methods, so that we're able to better make that connection to those individuals, not only about the importance of screening in the primary care setting, but helping them to better know what resources are available in the community for referral. And then we've also obviously put a high focus on community outreach and community events. So we've been doing resource fairs both during Fall Prevention Week, and then this past spring we were able to get out into the United Community Center for our first bilingual outreach event, which was a great success and something we were able to learn a lot through that. And so we continue to look at ways that we can increase our partnerships, leverage the various stakeholders in our community, and be able to reach different populations throughout the community.
Identifying the public health problem in the community and key strategies to be able to address and frame the efforts was really one of the key components to our success. And then utilizing that diverse steering team that I mentioned earlier to develop these key strategies and then guide our efforts really is what, kind of pushes our work forward on a daily basis. Utilizing our coalition as a whole, after the steering team really sets that vision, we utilize the coalition to be able to do short cycles of work. And so it's focused on key goals. What's great about those is that we're able to engage those coalition members and their different perspectives and backgrounds to be able to gain their interest and engagement in the coalition ongoing, and really go on those short cycles so that folks feel that they have the perspective and expertise to be able to bring to the coalition and keep that engagement there. Utilizing that diverse representation also brings in that fresh perspective, and it helps us to grow the coalition and reach. So really targeting our efforts to bring in new members as we work towards those cycles, I think really helped us do that. And then forming strategic partnerships. I think aligning with the complementary programs in the community has been essential. So looking, we're working towards Advocate Aurora, our Aging Well initiative, and looking in the community at what complements that as well. So, the work with the Division on Aging, multiple health systems, which I think has been unique about our coalition, is that, a lot of times health systems don't work together, and it's been great to be able to partner in the effort. And then obviously utilizing the community organizations that are helping the constituents daily in fall prevention. Obviously, we all know that there's challenges, and that's really what kind of sets your work, right? So we started the coalition, as mentioned earlier, in the midst of the pandemic. While it's a challenge, I actually think it's been one of our strengths and kept the work. We've really stayed strong and kind of kept it going. Coordinating efforts across a large footprint. This is obviously Milwaukee County is very large. So looking at coordinating efforts around fall prevention is kind of a big feat. The lack of handoffs between levels of care is really kind of one of the things that was identified early on, that this is something that is lacking, that we continue to look at how we're going to close that gap. Engaging diverse communities in coalition planning, and obviously in the efforts as well, like where meeting them where they're at, and looking at where those gaps are. Measuring the impact of fall prevention efforts and the rates in the community. This is big, again, looking at how large our county is and all the different data points, but it really showing how to measure that impact and knowing that that could take years to be able to impact. Next slide. And then, the practical pearls that we have, a lot of this has probably already been touched on, but truly using that public health framework to set your plan and really align with that. Obviously, it creates that shared purpose. So define, and then from there, you can define that problem in the community for that shared purpose to be able to engage your stakeholders and keep them engaged. Because if you guys identify that problem together, then obviously that engagement will be there to be able to work collectively. Creating a strong foundation to support sustainability is huge. You know, it takes a village, right? So having all those players at the table and then creating the foundation in your documents, in your mission and vision, but also the coalition at large, being able to keep that engagement and the sustainability as you move forward. Leveraging existing programs, I believe everyone knows what this means, is that, you know, a lot of people don't want to do the extra work, that we're already doing a lot, but how can you leverage the work that you're already doing and leverage already what's happening, and then just build upon that to be able to better your efforts and around fall prevention. And then maximizing member involvement through action teams. You know, those are those short cycles. Getting people to get excited about that work is huge to be able to keep moving it forward and not have this be something that we're going to do for right now and then it stops. Rather that this is something we can do, move on, and then hit the next thing running.
All right, thanks, Ann, for wrapping us up here. So at this point, I'm going to turn it over to Chris, who will kind of facilitate our chat. Barb was kind enough to do a nice answer to the one question, but maybe we'll pose it anyway so everyone has a chance to hear it. And then if you have any other questions for our panel, please either raise your hand or throw those in the chat so that we can hear from you.
Yes, so Ed had asked what outcome has Brown County been tracking to see if they're making a difference? Is it falls rates, injurious fall rates, EMS runs, rates of ED fall visits? So I don't know, Barb, if you wanted, Barb answered this in the chat, but if you want to just touch on a couple of points there.
Sure, I just needed to unmute myself here. Yeah, we track really as much of that or all of it that we can. The inpatient counts on an annual basis to the hospitals, the inpatient ER counts. We try to get an unduplicated number, and that's why we add in the fall pickup number from our EMS. We don't want to duplicate with the number that they're transporting into the ER. One of the challenges we do have is that we cannot get at the data, those that report directly to urgent care or a clinic setting. That's one of the pieces of data we still haven't been able to tease out and include within that number. And then separate from that, we've done a lot more starting this year on process improvement with our EMS referrals as to what is actually happening with those referrals. Are we seeing any good coming out of that? Have they accepted any services, declined services? Are we unable to reach them? Those types of details, and if they accepted services, what kinds of things are they accepting? Is it home adaptive aid equipment? Is it other local supports or care in the home, that kind of thing? And we're early in gleaning out that data, which is a little bit tedious, but we feel it's really a critical feedback system to our EMS as to what's happening with those referrals.
Yeah, thanks, Barb. Jennifer asked if these slides are going to be available. We are recording this session, so the recording will be available, and I believe the slides can be shared. I don't think any of them are proprietary in a sense, so just yes. So the answer is yes. We will share those out. Are there other questions? I did note.
So this,
oh, go ahead. Go ahead.
Oh, this is just Dave from Green Bay. So I would say from being an EMS professional and working with the RTAC and now working in a hospital, I would say the number one thing that we lack on that is frustrating is data. Is there's so much data, but it's really hard to gauge, because once we've opened Pandora's boxes, which really what we've kind of all done in the last 3 years is we've opened up and went, wow, Falls is big. And then as you dig further and further, you're like, this is humongous. This is so big. Where are we going with this? And so you take little bits of success and you go, this is fantastic. I really wish we could get solid data from DHS, from EMS, from wards, from all these big components that hold the can of what we do, and really get better data. You know, you get bits and pieces of it. You can get your individual stuff from your EMS agencies, but it's hard to gather what's all happening and then be able to spill it back out to the community. So like when we tell the community, we have 32 falls a day just in Brown County every day, and they're blown away. They're like, well, I fell, but I'm not really the part of the problem. You're not? I mean, it's so big. So I wish if I could have a pipe dream is that we could have a statewide message to let the community know this is a huge problem. We all deal with this, and it's going to get bigger and bigger. And that they shouldn't be afraid to call us. They shouldn't be afraid to accept a referral. They shouldn't be afraid to come get help. Because I think that's one of our biggest challenges, particularly on public safety side, is they're very afraid to accept help because they think it's gonna take their freedom away. We want you to stay home. We want you to be injury free at home for a long time. So I wish we had a global statewide message, and I don't know who could do that, but that's just my tidbit is it'd be nice to have that overall umbrella that we're all saying the same thing. Just let us help.
Yeah, and I'm going to echo that, Dave. Kathy, go ahead.
Oh, I was going to echo what Dave said, but I'd like to advocate for public health messaging across the state, like the smoking campaigns and the messaging you see in PSAs on television and radio, and truly blanketing everybody, because like Dave said, it's not going to happen to me. It's they're falling and then I fall. So that was my 2 cents. I love the data idea. It's so hard to pull it all together, but what about that messaging to create that awareness too? So
yeah, and I was going to add to that. I think the one challenge we always have with data collection, I love what, Barb, what you guys are doing in Brown County with all the EMS tracking, but, sometimes making that connection from all this community outreach and awareness and building to, what is the impact on actually reducing a fall or a fall injury? We know that takes time. And we know that, in the perfect way, in the perfect world, you're reaching those people 5 years before they have that fall. And so some of that data is going to come downstream. But, to that point of digging into the data more, I think, in order to really craft our messaging in each community about where falls happen, what you need to do to prevent, we do need to be able to drill down into that data. So often people say, well, I don't go out in the winter, I don't trip on the ice, so I'm not at risk for falls. But we know that that's not where, the data is probably pointing us to where people really fall. It's in the home, it's in the bathroom. And so, being able to do that, not only to target where our efforts are, and what kind of prevention messaging we're putting out there, but to be able to better speak to that, I think is really important.
Well, you guys could not be teeing up what I'm about to say any more perfectly, but because the Wisconsin Institute for Healthy Aging has plans to move forward with the Falls Free Wisconsin Center, which would be a statewide place where folks can find information. Hopefully we will, as a coalition, as a statewide coalition, be able to coordinate some of the messaging, but there are resources, and we are planning for a statewide public awareness campaign around falls prevention. And another component of what we're going to try to do here is to create a data mining, an analysis function within that center, because we have heard you all talking about the challenges around, really being able to express both the need, but also like what's actually happening on the ground. So, we're going to be looking into all of the different data sources to try to find, really good ways where we can, express the need to decision makers, elected officials, the public, everyone, so that everybody can use some of the same data pieces to be able to really draw a straight line from what we're doing to more of a population level impact. So that's the goal. And just, and this is not telling you super much yet, I know, because we don't have a lot of time to talk about it, but at another point, we'll be coming out and talking more about how we're going to go about doing that and invite people in to play a role. I see one other question here, Kathy, time permitting, can you share more about your utilization of a strategic planning coach for your group's work?
Absolutely. So we have access to 2 coaches. We were given access to them through the Oshkosh Community Foundation. They deemed us a worthy cause, and when we identified that we wanted to be more than just a marketing arm and a coalition. We wanted to do good. So, Barb, tell me specifically, are you interested in more in how we connected with them or what we do with them?
Actually, more of what you do with them. How has that helped your group? Because I think it's a great idea to rejuvenate a group.
Oh, absolutely. So working with this coach, you know, when you do strategic planning, they ask really hard, really hard questions. So what we have done is our coaches have gathered us for a number of meetings and they have said, what do you do? And then we've identified the things we do. And then they've gone around the room and asked, do you think that meets your mission? Do you not think that meets your mission? So they're getting into the nitty gritty of what each of the members believes our mission is and what we need to move forward. And so we are honing down, and I think it was Susie and Ann who said something about, or maybe it was you, multiple goals. They are helping us hone down. And whether or not we, for example, are actually providing the education or we are creating the awareness of how to get, say, evidence-based education or how to get the assistance from another. Where we felt we were an education organization, they've questioned that and we're still going back and forth. So I think that's the thing, is they just keep asking the hard questions of our members to ensure that we're all on that same page rather than pulling us in multiple directions. Can I be more specific about any piece of that?
No, that's awesome. Thank you.
All right, so thank you everyone for presenting, and thanks Kathy for sharing about the strategic planning coach. That's a really unique thing that is exciting to hear. I wish we could steal yours and send them our direction. That would be great. The last thing we wanted to do, and I'll share my screen again, is we just wanted to spend a little time talking about options and resources that are available for those who are on a coalition journey, are looking to start a coalition, or to rejuvenate a coalition. So let me go to the next slide here. So we'll just talk a little bit about the work we've been doing through the state best practice group to create a fall prevention coalition quick guide. So we all know the benefits of a coalition. I think the panel that have been speaking here today along with me have tried to bring that to you. I mean, it's about really creating those connections. We know that none of us can do this work alone. And that we really want to create that broader awareness through multiple stakeholders, and try to prevent us from all doing this work in silos and duplicating efforts, and have a much more kind of strategic and cohesive approach to the work we're doing. This is the list that our coalition best practice work group had put together of current coalitions that existed in the state of Wisconsin. There may be others that are doing some fall prevention work as part of other coalitions or other initiatives within their counties, but a huge shout out to all those who are doing coalition work at this point in time. What we've developed really is this concept of resources to support local coalitions. So and Chris, maybe you could drop in the chat a couple of those links for us, but the Falls Free Wisconsin coalition website has been created, which will serve as a place to access all the different resources, as well as updates on the work that we're doing at the state level, and the toolkit that's available. And then our coalition quick guide. This is really what our best practice group spent the last year or so, Barb and Ann, working on to create this. And what we did was we looked at the National Council on Aging's guide to creating state coalitions, and took that very large document and tried to whittle it down to something that was one, more personalized and more applicable to the state of Wisconsin, and also to the county community level. So we tried to create this as a way for those who are starting a new coalition, those who are trying to keep a coalition going, or those who encounter challenges like we all have over the last couple of years who want to re-energize that coalition. And we tried to provide toolkits from a lot of different communities within the state as just examples so that we can all learn from each other as we do this work moving forward. And I think this is you.
Sorry, I keep getting kicked out, but Susie, this was still yours.
Oh, okay. So the things that we put into the quick guide, was it talks a little bit about how you get started. It's broken down into different sections. So how you form the coalition, how you make the case, how you engage your key partners and stakeholders, how you start and launch that coalition. So for those who are coming into this new, how do you create some of those foundational documents? How do you recruit and engage that coalition, find the right people to come and be involved? How do you plan a way to start this off and even structure your meetings? And then especially for those who are a little farther in the journey is that maintenance and institutionalization of the work you're doing. So how do you keep members engaged? How do you create a regular strategy for communicating? And then, as many have spoken to, how do you keep this funded? How do you keep kind of the lights on with the work that you're doing? And then we tried to create some case studies from smaller and larger rural and urban communities as examples for this work.
Can you guys hear me?
Yep.
Okay. It's extremely valuable to, when really getting started, it's valuable to review state and local plans, as this is going to allow the ability to identify the key problems to address and be able to align your work. Really taking the time to collect some information early in the development of the group and discuss kind of what data is available to use in your planning efforts. It's important to have a well-defined mission and vision and key strategies based upon the needs and themes identified from the community conversations and the needs assessments that take place. This will serve as the foundation for better development of key objectives and actions that you'll take going forward. The formation of a core group or steering committee to develop these documents, then also have the ability to share that with the larger coalition so that they can also provide feedback, discussion, and then you guys can modify if needed as you go. Equally important is as well as really scanning the programs and services that already exist in the community in the areas of obviously fall prevention, but then utilizing your data and everything that you've now gathered to be able to identify the strengths and gaps in the community, assess what those needs are of the community, and to ensure the development of appropriate resources, intervention, and programs for the community. The foundational documents and strategic plan are essential to set the direction and keep the coalition focused. Developing these to address the collective community issues and fall prevention. And this is really meant to be, keeping in mind that this is meant to be revisited throughout to keep the work grounded on the set out mission. Recruiting coalition members and really taking the time to look at the county and those organizations that have a vested interest in fall prevention in the community allows really that engagement and the ability to collaborate around that shared purpose. When recruiting members, it's important to be inclusive as possible. And then you're going to be able to utilize the networking capacity of the core group. Engaging those with diverse skill sets and knowledge and backgrounds, obviously we've already discussed this to gain unique perspectives, and when possible, leveraging personal connections to contact and engage individuals for the coalition. It's recommended to really create a document that outlines expectations for those in the group, which really will help the promotion of the group as a whole. And then really you can do that and then look at how you're going to plan the kickoff meeting together. The first meeting is really important. Obviously, this kickoff meeting is to get attendees excited about helping older adults in fall prevention, in improving balance, mobility, and really make them feel that they're a part of this movement. The core group should plan this first meeting, and then depending on the direction after the coalition is established, the steering team can look at how they're going to further develop their meetings and the vision. Considering the coalition members who will be participating when selecting a format, really looking at, will you do, obviously we did a lot of our work in the pandemic, but, now that, you can really take a look at like, is in-person meetings, is that what folks want? Do they want virtual? Is it something hybrid? But really taking the group in consideration when making this, even doing like a poll or something like that to find and make sure that you're really addressing the needs so that everyone's busy to make sure that you're addressing and you're able to engage those regularly and make sure it works what's for majority. Setting the agenda regularly and reminders in advance of each meeting is essential. And then having folks engage in that planning too, to be able to encourage their participation. Communication throughout is essential. So it's not just while you're at the meeting, but there's a lot of different ways that you can engage. One of the things, and this should be done beyond the scheduled meetings. So creating a list of those folks that want to stay up to date to the coalition. So this necessarily might not be the ones that are actually a part of your coalition, but those that want to really have an understanding of what's happening and when there are events or things like that, that they can be a part of it. And it really gives that awareness and visibility to the effort. Creating a website to be able to, have the awareness continually be out there, but also an area for folks to be able to go for tools, resources that they need in fall prevention. And then finally, really engaging your coalition as a whole continually at the meetings, but beyond. So sending meeting summaries, everyone's busy, not everyone can attend each meeting, but that folks really feel that they have an understanding of what the work that's continually happening. And then having those resources, articles, and kind of key updates that they can know what's going on in the coalition and stay engaged. After obviously the coalition is formed, it's important to consider what's going to keep it viable to sustain it. This may include the coalition itself, the work.
Sorry, something happened with my screen. Hold on one second. Hold on a second, sorry. There you go. Uh-oh, did we lose Ann? I think we may have. Are you guys hearing me?
Yeah, she has dropped off a couple times. It might be
Okay.
her internet, so go ahead.
Yeah, so apologies for that. So, as we think about keeping the momentum going, you want to make sure that you have the right people at the table. And some of the things the toolkit talks about is, ways to engage older adults, create a process for onboarding individuals. And then, opportunities to really have a clear and consistent communication method. So, some of it is about making sure that the message is reaching people and that those at the table are staying engaged and coming away with something. So, taking away that concept of creating a movement. And as others have talked about earlier today, if there's particular events happening or a particular focus, really energizing around that can make a big impact. And then thinking about what motivates, the coalition. You want to leverage what you have. You want to celebrate those little wins and those successes, no matter how small. And then also, obviously for sustaining, of course, funding is important. So, looking at all those opportunities to not only connect with community partners for relationship building, but for that opportunity for funding. And then, seeing your successes. And I think that's something that is really important, is to share the wins that you've had, with your local community and to really be able to get that word out. As people who are focused on the outcomes with our older adults, we don't always think about, self-promoting the work we're doing. And I think the more that we can sing our own praises, the more that's going to help us to continue to move these efforts along. So we encourage you to check out the toolkit. I know that Chris dropped that into the chat here. So we also want to make a little plug for now is a great time to think about starting a coalition. There's some great opportunities available as it relates to funding. And Chris, I don't know if you want to just make a little plug and talk about the RFP for the grants through WEHA.
Yes, absolutely. Thanks. So as part of what I just mentioned a few minutes ago, the Falls Free Wisconsin Center, WEHA will be standing up this sort of statewide center with a virtual space where people can come to find falls prevention information. We hope to have some tools that are a little outside the box that people will be able to use to be able to identify falls in the home where we know most of the falls happen. We'll be looking to engage consumers, their families, and drive them to the center where they can find this information. We're also thinking in terms of like motivation, like how do we motivate people to want to move in the direction of changing behaviors or improving their reducing their falls risk. So that's something that's coming in 2023, and we'll be sharing a lot more about that as we sort of firm up the plans. But one component of this is we have an RFP out currently. It's called the LEAF Project, localizing efforts to address falls. I got that right because I don't have it in front of me. I just dropped it on the floor. But that opportunity is available at the link that I put into the chat. It's not a particularly long application process, so I would encourage you to go there and take a look. For those of you who are thinking about creating a coalition or even thinking about doing some kind of an event or initiative that would be the launch pad for a coalition down the road. We're looking for sort of creative ideas that you think would best match up in your community to fund. The funding, we're awarding up to $10,000. So you can apply for any amount from 0 to 10 or $1 to 10,000. The end of the grant technically is August 31st of 2023, but we are able to extend that into September for those who are interested in doing things around Falls Prevention Awareness Month. It wouldn't really be fair or nice, would it be, if we were to stop our funding and say everything has to stop, you know, the day before Falls Prevention Awareness Month starts. So if you have questions about that, we have held a couple of different Q&A sessions already to talk about that. But if you would like to access recordings of those, we have those on our website, so you can come and take a look. And I'm always available if you have questions or want to, you know, run an idea past me. So the deadline for applications is November 18th. That would be next Friday. But as I said, it's not a super long application. So go take a look. We encourage everyone to consider what it is they can do. And we're happy to provide some resources to make that happen.
Thanks, Chris. So with that, we are coming towards the end of our time. If anyone's got any final thoughts or questions for us, we're happy to take those. Oh, yeah, Dr. Duthie.
Thanks, Susie. Great presentation. I'm a physician and just wanted to point out one other thing that we've done at our meetings. At the first meeting, a person who sustained a fall recounted her story and her stepping on experience. And what the group has done has continued to bring in people from the community, not community agencies, but actually people who fell to recount their stories. I think Susie calls it our community impact speaker. And it's been very, and I think it gets us a little bit away from some of the large data sets, which we're interested in and need to know about. I think all of us are moved by the stories. And I think it's helped to keep some interest. So I don't know if others have done the same thing, but it's been something that has impacted me at least.
Yeah, thanks for sharing that, Dr. Duthie. And I echo that. I think we've had some powerful messages, and sometimes it's pointed us in the direction of things that the rest of us would never have focused on as being most important. So really grounding that work. All right. Well, thank you everyone for being here today. Chris, I'll let you just say kind of a final thank you and a plug for our sponsors if you'd like, and any other pearls that you want to add from the WeHave side. And we appreciate you hosting this venue today.
No, absolutely. Thanks again to all the speakers. Really enjoyed it, listening to, you know, the ways you're moving the needle in your community when it comes to falls prevention. So thank you all so much for that. Again, thanks to our sponsors, UW Health, Inclusa, iCare, and Humana for helping us put this on today. And thanks to everyone who attended. We really appreciate your interest in this. We do, someone just recently said, this is a movement. This is such an important issue. And what we have on our side in some ways is that trying to get people to understand what a fall isn't the challenge. It's really getting to move people to act in their own best interests and avail themselves of some of the resources that can reduce their risk. So that's what we're looking to do. And we're looking for everybody who's interested to join us all in terms of creating those local coalitions that can make a great difference in the community. So thanks all for coming.
Thank you.
Thank you for having us, Chris.